As Zika threat grows in U.S., testing lags for a vulnerable group. As the Zika virus swept north from Brazil into the Caribbean, bringing with it frightening risks for pregnant women and their unborn children, United States health officials decided in February that all expectant women who had visited the countries affected should be tested for the disease. But after the guidelines were put in place, public health officials and doctors in New York City found that large numbers of women, many uninsured or low-income immigrants from the Caribbean and Latin America, were not being screened and tested in a systematic way. The problems facing the city's healthcare providers in ensuring that all of those who need testing can get it illustrates the monumental challenges involved in reaching those considered most at risk. And as summer approaches, the reach of mosquitoes that carry the virus is expected to extend to Florida and other states along the Gulf of Mexico. The exact number of people missed is not known, because nobody really keeps data on how many women who traveled to a Zika area should be tested, said Dr. Jay Varma, Deputy Commissioner for Disease Control at the New York City Department of Health and Mental Hygiene. But officials found that a disproportionate number of those tested were from higher-income neighborhoods, compared with a smaller figure for lower-income neighborhoods with large populations of immigrants from Zika-associated places, Dr. Varma said. In February, after the new guidelines were put in place, 1,166 tests were performed in the city, 505 of them on pregnant women. But even as awareness grew about the virus and its ties to microcephaly, abnormally small heads and brain damage in infants of infected mothers, the number of tests performed fell. In March, 233 pregnant women were tested, and by May that number had edged up to only 318. The reasons for that lag are complicated, officials said, and include the absence of an effective commercial test, the resistance of doctors to performing the tests when they deem the risk minimal, and a lack of resources for overwhelmed public hospitals and clinics. Continue reading the main story. Zika virus. Complete coverage of the spread of Zika virus and efforts to contain it. Spraying begins in Miami to combat the Zika virus. August 4. Florida's $82 billion tourism industry braces for Zika. August 3. 33 U.S. service members have contracted Zika, Pentagon says. August 3. Tim Kaine, straddling dual roles, calls for Congress to provide Zika funding. August 3. Zika surge in Miami neighborhood prompts travel warning. August 1. See more. Recent comments. Sharon Burns, June 19, 2016. I learned about the sad potential merely by coincidence. I had a swollen knee post-surgery. I saw an elderly doctor who prescribed me the. Sharon Burns, June 19, 2016. CDC has not responded to my question regarding yellow fever. I hope it at least gets a response in 2016. The Aedes aegypti mosquito spreads. Nancy, June 18, 2016. Okay, I think I lost the comment I wrote. If to show up, my apologies. First, the no commercial test to me means that the doctors' hospitals. See all comments. One of the biggest stumbling blocks arose from an effort to fix another problem. Some 70% of early samples sent to public health labs for testing were rendered useless, because they were mislabeled or improperly collected or handled. Doctors, therefore, were required to telephone the health department for every sample that they wanted to submit, according to Dr. Mary T. Bassett, the city health commissioner. And ordering a single Zika test in New York City requires a call that lasts, on average, 13 minutes, health officials said.